When it comes to infant deaths, Ohio is near the top of the list. Now, Premier Health and its hospitals are working to lower that mortality rate. And starting next month, they will use sleep sacks in place of blankets in their birthing centers. And Sherry Young and Jeannie Ponziani are both with Premier Health. And they join us this morning with more on the Safe Sleep Project, if I can get that out. Good morning to the both of you all.
Morning.
And, you know, it's startling that we are highest here in Ohio for mortality rates. And so, you know, I'm sure moms, they want to be close to their baby, but the number one mistake is sleeping with that child, correct?
Well, there's many things that happen with sleep with our infants, and the use of the Safe Sleep Sack is just one of the pieces. But it's important for the moms to realize that the babies need to be alone. They need to sleep alone, not in the bed with them. They need to be in a crib all by themselves, with no blankets, no toys, no bumpers, any of those cute things that grandmas make and bring. They need to be on their back, and the sleep sack that we're going to be implementing across the system is one of the ways that we're encouraging parents to help take care of their infants.
And I've recently gone to a few baby showers. You know, typically you give the blankets, and I recently saw these swaddles, and I was like, I'm not sure what that is, and I didn't buy it because I wasn't sure what it is, but it looks complicated. But I mean, kind of show us. You just said it's not too bad to put this on, right?
It isn't at all. And in fact, it's referred to kind of as a wearable blanket, which means that babies can remain the right temperature, can be safe and snuggled up, but without fear of the blanket becoming loose and them becoming entrapped in the blanket, or the blanket's up around the head and face.
And you would think that they're so confined in there because you're kind of tying up their arms and everything, but they are comfortable in
Brand new babies like to be swaddled. They've been in a pretty tight environment before they're born. So typically, early on, they like to be swaddled. As they get a little bit bigger, the recommendation is that you move from this actual swaddling process to just this wearable sleep sack kind of unit, and those are available for purchase as well.
Okay. And so kind of tell us the general guidelines, well, you know, for new moms. You said the ABCs of sleeping, correct? Kind of walk us through that.
Well, A is to be alone, in the crib by themselves, not in a bed, not sleeping on the couch. They need to be alone. They need to be on their back, and they need to have a crib to sleep in. They need to have their own separate space to sleep.
Okay, and so starting May 1st, you are going to have these at the hospital, correct?
We will be, the nursing staff will be using these across the system.
That's right.
And so what's been the reception so far when you showed moms the swaddle and why this is more important, I guess, than the blanket? I mean, are they pretty easy to make that transition?
They are easy to make the transition, and parents always have that need to keep these babies bundled up, and this works extremely well. And they're very receptive to the idea that this is one piece of keeping their baby safe and alive. You know, we have a big emphasis on this. We want every baby to celebrate their first birthday. And so all of these principles about safe sleep are really for the first year of life, and we want every parent to have this information. With 8,000 deliveries across the Premier system, it's a great opportunity.
Okay, well, great information there, and a great campaign that you all are doing here. And for more on the Safe Sleep, just log on to fox45now.com and click on Fox 45 in the morning.